let's go to our next question. A patient who was bedridden after neurosurgery presented with a lesion as shown in this image. Okay, so what is the grading in this case? So in this image and the clinical scenario that has been given here, you can easily able to see that it is a scenario with a bed sore, right? This is scenario of bed sore. Okay, so regarding the bed sore, it sore is basically gangrene. Now this gangrene basically develops due to local increase in pressure, local pressure. Now, typically, a patient who are basically bedridden for a longer duration of time, in those patients, we eventually see a bed sore like this, right? So, your bed sore basically associated with a few predisposing factor apart from the local pressure. Okay, so we have the injury, like the local injuries at the particular area, and that also due to the increased local pressure basically takes time to heal. Apart from that, the anemia that also delays the wound healing mechanism, and your moisture, because a patient who are basically bedridden for the longer duration, or in a patient with a stroke, they basically just lost their control over the bladder and bowel. Okay, so as a result of that, there is a lots of this bladder bowel content spillage has been seen in such cases, that basically raise the moisture in that local area, that basically make this patient much more susceptible to develop the bed sore. Okay, also your malnutrition is another important factor in such cases. Now let's try to understand what are the important pressure sore site. Okay, so eventually it basically takes more than 30 millimeter Hg of pressure to develop the pressure sore. Your most common site of the pressure sore is your ischium, and followed by greater trochanter and sacrum. Okay, apart from the sacrum, you have the heel, lateral malleolus more than that of the medial malleolus, and you have the occiput as well. So you can see in this image, right? So this pressure source usually develops typically at the pressure point only. Okay, pressure point only. Now let's try to understand the pressure sore staging. Okay, so your stage 1, that is basically your non-blanchable erythema. Non-blanchable erythema that has been seen in this cases, or this in this stage, but there is a no breach of the skin. Okay, so entire epidermis and the dermis both will remain intact. Only thing we can able to see is that the erythema in this case. Okay, so your erythema in this case is only thing you can see. You can see that, followed by your stage 2. So in case of stage 2, what we are going to see is that there is a breach of epidermis and dermis, but this breach eventually uh, does not extended into the subcutaneous tissue in that case. Okay, so that will be eventually characterized by superficial ulcer or superficial shallow crater. Sometime a blister or abrasion may leads to formation of this stage 2 bed sore ulcer. Okay, then comes your stage 3. So in case of stage 3, you can see that there is a breach of the dermis and epidermis as well as the fat layer or the subcutaneous layer as well, but it does not breach the fascia. Okay, it does not breach the underlying fascia. Okay, so here we are able to see a deep crater or the deep ulcer in that patient. Okay, deep ulcer, followed by you have the stage 4. So in case of stage 4, you can easily able to see that the whole area is basically involvement, there is involvement of the uh, dermis and epidermis, there is involvement of the subcutaneous tissue and the underlying muscle and the bone as well. So this is the key feature. So there is involvement of the underlying bone and muscle. In this image as well, you can able to see that there is a presence of bone and the underlying muscle that could be seen in here as well. Okay, here you can see. Okay, so there is a full thickness loss of the skin and the underlying tissue, and there is a extensive tissue destruction. Extensive tissue destruction has been seen, involvement of the muscle, bone, and joint, even the tendon involvement has been seen. Now let's try to understand what are the treatment protocol we have in such cases. So number one, for the stage 1, basically the conservative management is supposed to be enough. So if there is any immunocompromised state, you have to correct that. Like there is a anemia, diabetes, these are the specific scenario when you do need to correct that aspect as well. Apart from that, frequent changing of the posture is very important. Use of the air mattress or water bed, basically keep that local pressure evenly distributed. Okay, so these are the important thing, and apart from that, you have to keep that area dry as well. You have to explain your patient and the patient party that uh, the moisture is basically bad for that area. So always ask them to keep that area dry. Okay. Following that, for the stage 2 and the stage 3, it's a simple debridement is basically enough. You can also go for severe debridement and the dressing. In a wide scenario, uh, we also like to use the NPWT or the negative pressure wound therapy or the vacuum dressing therapy in such patient, and we can see a uh, good result with the NPWT therapy as well. Apart from that, we have the stage 4. So in case of stage 4, your debridement followed by flap repair. Flap repair is supposed to be done. Among them, your tensor fascia lata flap based upon the lateral cutaneous, lateral circumflex femoral vessels is going to be one of the important aspect. Okay. So in the treatment, as I have already mentioned, you have to keep the moisture away from that area, from that pressure point area. This is the number one. So keep that area dry. Frequent changing of the position. So there is a two kind of patient we eventually see. Some patients are eventually bedridden, and some patients are basically wheelchair bound. So in case of bedridden patient, you ask them to change their posture every 2 hourly. Okay. So this is the number one. In case of wheelchair bound patient, you ask them to lift themselves off their seat, okay, every 10 minutes for 10 seconds every 10 minutes. Also, we have the utilization of the airbag, which will eventually uh, evenly distribute the pressure. Okay. And last but not the least, your proper nutrition is also going to be very much helpful in such scenario. So in this question, you can easily able to see that there is a only little bit amount of the breach has been seen in the dermis and the epidermis. So there is a no breach in the subcutaneous tissue, right? So that basically conclude it as a grade 2. Okay, grade 2. So you can see that there is a small ulcer or the small superficial crater has been seen in this image. So it's a grade 2, right? Now let's take another question from the same topic. So a 74 years old male patient was bedridden for 15 years, shown in this image, right? So he developed bed sore. What is the grade of the bed sore in this image, right? So here you can see that there is a some amount of the slug. So this is a slug or necrotic tissue. Black necrotic tissue has been there. So this necrotic tissue eventually covered the base of the ulcer, right? Base of the pressure sore. So it basically classified under grade 4. Why? Look, here in case of grade 4, the ulcer basically extended not only into the skin and subcutaneous tissue, also the deeper structure, means your bone, tendon, muscle as well. But here, the necrosis and the slug that has been there present, possibly exposing the deep structure like the fascia and muscle. So this necrosis or the necrotic tissue and the slug, that basically suggesting us towards the involvement of deeper tissue. Okay, so in that case, if we are able to found any necrotic or the slug tissue over that uh, ulcer, we have to suspect it as a grade 4 bed sore. Okay. So regarding the incorrect option, obviously your grade 1, you know, it's a basically simple erythema with a intact skin without any breach of the dermis epidermis. Grade 2, partial thickness, skin loss with a blister, no necrosis on the subcutaneous tissue reach. Grade 3 means full thickness loss with a involvement of the subcutaneous tissue, but without involvement of muscle and bone. That's it. So here your answer is going to be grade 4 because this slug up or necrotic tissue. That's it.